You know that moment of panic? You spot a mysterious rash on your child's skin? Where did it come from? What is it? Well, it's a super common mystery. And in this explainer, we're going to put on our detective hats, follow the clues, and crack the case of viral skin rashes. So let's set the scene. A kid wakes up with some new, totally unfamiliar rash. Is it an allergy? Maybe something they ate? Or could a virus be the real culprit here? Let's follow the evidence one step at a time and figure out what's really going on. All right, our first investigative step is absolutely crucial. We've got to figure out if our suspect is a virus or if it's an adverse reaction to a medication. You know, they can look surprisingly similar, but they leave behind very different clues. The first clues are all about timing and symptoms. Viral rashes, they tend to show up in the spring and summer, and they often bring along accomplices like a fever or a cough. A drug-induced rash, on the other hand, can pop up any time of year. But here's a key giveaway: the itch factor. Drug rashes are often intensely itchy, while most viral rashes, not so much. Okay, so let's say we're pretty sure a virus is our culprit. Well, it's time to bring in the usual suspects. Let's take a good look at the lineup of the most common viral rashes you're likely to run into. First up in the lineup, we have rubeola, but you probably know it as measles. This one is highly contagious, spreading through respiratory droplets. And while vaccination has made it way less common, it's a really serious illness that we absolutely need to be able to identify. Measles has this unique calling card, something called Koblick spots. And get this, before the main rash even shows up, you might see these tiny little spots inside the cheek that look almost like grains of salt on a red background. They're a classic, definitive clue that pops up early in the investigation. Now, measles isn't just some simple rash. It can be incredibly dangerous. For every 1,000 kids who get measles, just one, will develop acute encephalitis. That's a swelling of the brain that can cause permanent damage or even be fatal. It's a pretty stark reminder of why this virus has to be taken so seriously. And this case is definitely not closed. In fact, it's getting more urgent. Between 2021 and 2022, global deaths from measles shot up by a staggering 43%. This just underscores how critical vaccination is in preventing these kinds of outbreaks. Our next suspect is erythema infectiosum, but it's much better known as fifth disease. This one's caused by something called parvovirus B19. It's super common in children between 4 and 10 years old, and you'll usually see it in the winter and spring. So if measles has Koblick spots, fifth disease has this. It's a bright red rash on the cheeks that looks, well, exactly like the name suggests. It's such a distinctive feature that it often makes for a really quick and easy identification. You can't miss it. What's really fascinating here is how the rash evolves. It doesn't just show up and then fade away. Nope. It follows this really unique 3-stage pattern. First, you get the slap cheeks. Then, a blotchy rash starts to appear on the arms and legs. And finally, as it fades, it leaves behind this really beautiful, almost leaf-like pattern on the skin. This whole progression is a key piece of evidence. Our third suspect is one you've probably heard of, especially if you have kids in daycare or preschool: hand, foot, and mouth disease. This one is caused by a group of viruses called enteroviruses, and as you can probably guess, it is extremely contagious. The biggest clue for this virus is right there in the name. It causes these painful sores inside the mouth and a rash of small blisters on the palms of the hands and the soles of the feet. You might also see them pop up on the knees, elbows, or even the buttocks. That specific location of the rash, that's the dead giveaway for this incredibly contagious virus. You know, comparing the patterns of these viruses side by side can reveal that final game-winning clue. We've already looked at measles and fifth disease, but let's add a third one to the lineup: roseola. Its pattern is completely unique. With roseola, a child has a high fever for several days, but the rash only shows up once that fever suddenly breaks. It's the total opposite of what you'd expect. Okay, so we've identified our suspects. Now what? How do we manage the scene? Well, the focus shifts from investigation to action. It's all about providing comfort and, of course, preventing the spread. You know, the best investigation is the one that never has to happen in the first place. Prevention is all about simple but super effective measures: thorough hand washing, covering your coughs and sneezes, and for the really serious illnesses like measles, the MMR vaccine is still our most powerful tool. For a child who's really uncomfortable, these steps can bring a ton of relief. Things like cool compresses, lukewarm baths, maybe with a little colloidal oatmeal mixed in, and keeping their fingernails trimmed short so they don't damage their skin from scratching. These simple, non-medical actions can make a huge difference.
Okay, everybody listen up, because this is a critical piece of evidence for anyone doing at-home care. Never, ever give aspirin. You might see it labeled as ASA to a child or a teenager who has a viral infection. It's linked to something called Raynaud's syndrome, which is a rare but incredibly serious condition that can cause swelling in the brain and liver.
So what can you use to manage that fever and pain? Well, fever reducers like acetaminophen or ibuprofen are the recommended options. Just remember, they don't cure the virus itself, but they can definitely provide a lot of comfort while the body's immune system does its job.
So while we can do a lot of great detective work at home, sometimes you just need to call in a professional. And knowing when it's time to escalate the case is just as important as that initial investigation. Here are your red flags. If you're just not sure what's causing the rash, if it's paired with a high fever and the person just seems really unwell, or if they have any kind of underlying health condition that might compromise their immune system, that's when it's time to stop investigating and call the doctor. And that brings our investigation to a close. We've seen how to identify these viral culprits and how to manage the scene. But as we see diseases like measles making a comeback, it leaves us with one last really crucial question. What does all this evidence tell us about the importance of the clues, like vaccines, that we already have to prevent these mysteries from happening in the first place? Thanks so much for joining this explainer.